ਮਿਸ਼ਨ ਚੜ੍ਹਦੀ ਕਲਾ। ਮੈਂ ਪੂਰੇ ਦੇਸ਼ ਦੇ ਨਾਗਰਿਕਾਂ ਨੂੰ, ਉਦਯੋਗਪਤੀਆਂ ਨੂੰ, ਚੈਰੀਟੇਬਲ ਟਰਸਟ ਨੂੰ, ਕਲਾਕਾਰਾਂ ਨੂੰ, ਜਿਹੜੇ ਵੀ ਹੁਣ ਪੁਨਰਵਾਸ ਦੇ ਤੇ ਪੰਜਾਬ ਨੂੰ ਦੁਬਾਰੇ ਪੈਰਾਂ ਸਿਰ ਖੜਾ ਕਰਨ ਦੇ ਵਿੱਚ ਆਪਣਾ ਹਿੱਸਾ ਪਾਉਣਾ ਚਾਹੁੰਦੇ ਨੇ, ਉਹਨਾਂ ਨੂੰ ਅਪੀਲ ਕਰਦਾ, ਦਿਲੋਂ ਅਪੀਲ ਕਰਦਾ ਕਿ ਆਓ ਪੰਜਾਬ ਨਾਲ ਖੜੀਏ, ਆਓ ਪੰਜਾਬ ਨੂੰ ਦੁਬਾਰਾ ਪੰਜਾਬ ਬਣਾਈਏ। ਔਰ ਮੈਂ ਵਚਨ ਦਿੰਦਾ ਕਿ ਤੁਹਾਡੇ ਦੁਆਰਾ ਦਸਾਂ ਨਾਉਂ ਦੀ ਕਮਾਈ ਚੋਂ ਕੱਢਿਆ ਗਿਆ ਦਸਵੰਧ, ਤੁਹਾਡਾ ਦਿੱਤਾ ਹੋਇਆ 1-1 ਰੁਪਈਆ ਅਸੀਂ ਪੂਰੀ ਪਾਰਦਰਸ਼ਤਾ ਨਾਲ ਤੇ ਇਮਾਨਦਾਰੀ ਨਾਲ ਇਸਤੇਮਾਲ ਕਰਾਂਗੇ। 1 ਰੁਪਈਏ ਨੂੰ 1.25 ਰੁਪਈਆ ਬਣਾ ਕੇ ਅੱਗੇ ਭੇਜਾਂਗੇ। ਜ਼ਿਆਦਾ ਡਿਟੇਲ ਵਾਸਤੇ ਤੁਸੀਂ rangla.punjab.gov.in ਇਹ ਵੈਬਸਾਈਟ ਤੇ ਜਾ ਸਕਦੇ ਹੋ। ਇੱਥੋਂ ਤੁਹਾਨੂੰ ਡਿਟੇਲ ਮਿਲ ਜੂਗੀ। ਖੁੱਲ੍ਹ ਦਿਲੀ ਨਾਲ ਮਿਸ਼ਨ ਚੜ੍ਹਦੀ ਕਲਾ 'ਚ ਹਿੱਸਾ ਪਾਓ ਔਰ ਆਜੋ ਦੱਸੀਏ ਦੁਨੀਆ ਨੂੰ ਕਿ ਪੰਜਾਬ ਕਿਸੇ ਵੀ ਸੰਕਟ ਤੋਂ ਹਾਰਦਾ ਨਹੀਂ, ਪੰਜਾਬ ਹਮੇਸ਼ਾ ਚੜ੍ਹਦੀ ਕਲਾ 'ਚ ਰਹਿੰਦਾ ਹੈ।
If ever it happens that AI is using the humans, that will be the end of history, and that should never happen. The real intelligence should always stay above or in control of AI. So that's a word of caution. So in the first phase, you see AI, machine learning, it replaced physical labor. Like you had, like take Maruti. They used to make one car in 58 seconds, and there were 150 persons working to make that car. So now they make that car in less than 30 seconds, but there are very few, 5 or 6 persons working that. So it replaced physical labor. So now it will replace the intellectual labor. So that's very important for all of you sitting this. People working in hospitals, people working in medical colleges, people working in dispensaries. You see, we have this medical satsang is a mixed one. We have people working in a very remote dispensary where maybe the light is not there most of the time. They don't have the air conditioners, or working in very trying circumstances. Our CHOs, our ANMs and our ASHA workers. And then we have the middle range, our district hospitals, sub-region hospitals, where you have the reasonable facilities. And then you have the medical colleges and corporate hospitals, and where we have a much better facility, maybe not the best ones, but we have our professors, and where you see the diagnostic test of choice also varies accordingly that. But coming back to today's point, God doesn't want its creation to suffer. The government, particularly, you see, this has become possible because we had somebody like Mr. Arvind Kejriwal, then we had Bhagwant Mann ji, our Worthy Chief Minister, Manish Sisodia ji, who think differently from traditional politicians who talk about, you see, religion, caste. These were the kind of issues, nationalism or pseudo-nationalism, pseudo-secularism, secularism. So these were the issues for elections. But it was first time that somebody introduced education, health, and our Worthy Chief Minister has taken a very good. Today we are launching another initiative. That's universal health care, universal health coverage. So it's very important that we use appropriate technology at appropriate stage. It's a good screening tool, I would say, as like the two very eminent gynecologists they have pointed out from medical colleges. Ultimately, of course, the RI has to remain superior, and you see, this is a screening tool where the patients are screened in the large scale, which cannot be done by the doctors. We don't have so many doctors to do that. So people are screened by the basic frontline workers, maybe ASHA workers, maybe NMs or CHOs. Then they are referred to the district hospital where further tests can be done. Then they come to the medical college where you have all the mammography and diagnostic biopsies. These tools can also be used to see a precision guided procedure, like we use ultrasound now for various procedures, cardiac procedures, neurological, then you know where is the lesion, where to suspect, where to put your needle in. So these can be very useful tools for that. So most of the time we are diagnosing cancers at the 3rd stage or the 4th stage when it's too late. But with these technologies, we can diagnose them in the first stage or second stage when they are still curable, and the ladies don't have to do what Angelina Jolie has done. You don't get the normal breast removed, and you can wait for one or second stage. So similarly, you don't sacrifice your other body parts just suspecting that you have a gene and you will develop this cancer. So that all that is avoidable. So ਸਾਡੇ ਮਾਨਯੋਗ ਸਾਡੇ ਮੁੱਖ ਮੰਤਰੀ and Arvind Kejriwal ji, they are very keen to provide the best possible health care, and I can you see the words are failing me to thank the NGOs who are helping us with this new technologies, with the resources, both human, technological, and even financial, all kind of resources. And our team is working very hard and putting all the best efforts they can. And right now Punjab is passing through a crisis. So despite that, we are discussing this also, and most of the people, we are working 7 days a week, even on gusted holidays and Sundays. So our team is working even on those days, and under very difficult circumstances, we have been able to control vector-borne and waterborne diseases to a great extent and save many more lives. So similarly for cancer, we can work together. I have an open mind. Being an eye surgeon, I know they only mentioned about autoref. That's very useful tool for kids, because you see the child doesn't know what kind of word is this. If it's hazy, he thinks the word is like this. So then the child may have problem in one eye. We call a condition which is amblyopia or a lazy eye. So after the child is reached the age of 10 years, it's not curable. So for the rest of life, he has to live with low vision. So similarly, you see, fundus camera, that's even more important. Glaucoma, kala motia. So patient will become blind or nearly blind when the doctor can diagnose it. Not many doctors use that technology where they can diagnose that. I learned it much later, after nearly after 15-20 years of my service. I learned that vitreoretinal services. Similarly, diabetic retinopathy is the leading cause of blindness, and irreparable one. If it's diagnosed early like cancer, you can treat the patient, and patient will never be blind.